Hello everyone, here we are with the patient seeking correction for her facial deformity, so as to say. It's a craniofacial deformity for her and it's only on one side, if we can see, at the left side of her face. She has sought a lot of treatments before this. She has gone to various centers in the country seeking treatment for discolored skin. So if we see, she has a discoloration and depression over here, right at the corner of the mouth. She has a discoloration and depression on this, which is left side of the face, and also on the forehead. If we see, if we look very closely, we see that there are contours in the forehead. It's not in the same plane. So if we see, there is a prominence, so as to say, followed by depression in the midline, another prominence and a depression. So there are pits and grooves and hollowings and protuberances in the forehead. It's not on the same plane. Also on the left side, if we see, her skin has got little discoloration right up till the neck. There is hollowing and grooving again on the left side. So if we see, this is a sort of a Peri-Romberg syndrome. So on the right side, the face looks uniform, and the left side there is depression and hollowing, which makes her face asymmetrical. When she went previously, the doctor suggested to take a skin biopsy, thinking it could be a facial discoloration, and this is exactly where a punch biopsy has been taken from. And she has been on anti-cancer drugs before this, because the absence of a right diagnosis, it could not be diagnosed as a craniofacial defect before that. She has stopped that. She is not on any medication at the moment. It's been more than 6 months to 1 year that you're not taking any medicine, right? Also, her blood parameters were all haywire because of the medicines she was taking. Now it's settled, it's come to a constant. She's fit for surgery, and it's going to be a craniofacial surgery for her, where the forehead, upper 1/3, lower 1/3 will be treated. Also, if possible, the middle 1/3. It is going to be a long surgery by Dr. Richardson. Her scan has been taken. We have prepped her up for a bicoronal flap for the upper 1/3 and for an intraoral incision for the lower one. Let's see how it goes. Thank you.
72 kg. 130, 72 kg. இது கொஞ்சம் வலி இருக்கு ரைட்டா?
அந்த இன்ஜெக்ஷன் மட்டும் கொஞ்சம் லேசாக வலி கொடுக்கும். அதுக்கப்புறம் ஒரு வலி
We've done augmented on the left side, alloplastic material used. We've done reduction on the right side, angle osteoplasty, osteoplastic genioplasty, and this is how she is right now. I'll show you the side view too, and then we're going to show you the pre-op. So you can see that severe deformity, the entire lower third of the face, middle third and also the upper third involved. We've already corrected the middle and the upper third and then changed the tube now. So we're going to show you some more views so you can understand the deformity and the correction. That's her before. So you can obviously see the dimpling, the grooving, asymmetry, the protrusion, the lack of bone, and that's her right now. Yeah, there's still a small notching on the lip, but it's already taken us around 7 hours, the entire surgery, so we're going to keep that for the next time. You can see the improvement. Eye below, and look at that, eye below. Malar work done too, augmentation, buccal pad fat removal on the right side, cheek contouring on the right side, umpteen number of procedures. And this is where she's moved to currently. 1 week post craniofacial surgery, we're going to show you what all was done for her. So we did work on the forehead, on the scalp, on the nasal base, on the upper jaw, on the lower jaw, chin, angle. So I'm just removing some of the attached hair because it's on the all right, so one part of it is out. Okay. Open பண்ணுங்க. Bite. Open. It's all perfect. Okay, we're going to take this one also. Yeah, this needs some amount of soaking. Kanna mudirunga. Close your eyes. So by the time we're going to take that out, so I'm going to show you so the major issues. You can see that there was a main issue on this part of the face, here a little bit, here a little bit. You can see the depression, the asymmetry, the grooving. So there's still some swelling here, but the grooving, it's going to go off, and this swelling, look up, you can have a look. So this was a 7-hour long surgery that we did for her, and yeah, sorry. So whatever I do, a little bit of this hair, sorry. Okay. Can you give me a bigger scissors? So I can cut more of the hair in one go. Wow. Sorry about that. You can see now, you can see the mirror, how you look. See the top. So many sutures. Can you see? So we've got all of these are sutures, okay? So we've used staples because we opened it from here to come to the forehead, yeah? Up to the nose. It's all healed very well. But we're not going to be removing these yet because this is just 7 days up. Okay, we're going to wait for a few more days. And probably on day 10 or something, we'll remove it. So you got to continue with the peptides. You can actually stay பண்ணலாம்.
Yeah.
இன்னைக்கு ஸ்டே பண்ணலாம் because appointment இன்னைக்கு வரல.
Okay.
So till appointment comes, நீங்க stay பண்ணிக்கலாம், maybe 1 or 2 days, whenever that is. Doctor will tell you. And then 10th day, அது எடுப்போம், you can go. Till such a time, you need to get the antibiotics for coverage.
Okay.
சரியா? And what else? இன்னைக்கு நீங்க குளிக்க முடியாது, face wash பண்ணிக்கலாம் இன்னைக்கு. Only extra thing. Diet continue the same.
Okay.
You can
good diet.
little soft solid, but no eating anything on the left side. You can use the right side for chewing. அவ்வளோதான், அதே மாதிரி கண்டினியூ பண்ணுங்கள். இப்போ பண்ணியிருக்கு பர்ஃபெக்டாக இருக்குது. கண்டினியூ த சேம் திங். வாய் உள்ள ஒரு ஆயின்மெண்ட் போட்டு விட்டுருவாங்க, அதை போடுங்க, இங்கே இருங்க கொஞ்ச நாள். மேலே ஜஸ்ட்டு கீப் அ முப்பிரோசின் soaked gauze, yeah, and then put the tape all across. பர்ஃபெக்ட், எல்லாமே பர்ஃபெக்டாக இருக்குது. அவ்வளோ ஸ்டிச்சிங் மேலே கீழே எல்லாம் பர்ஃபெக்டாக அப்படியே கண்டினியூ பண்ணுங்கள். சரியா? குட். யா, அது வந்து இட் வில் டேக் டைம், 3 months எல்லாம் ஆகும். பட் இட் வில் ஃபுல்லி கம் பேக் டு பர்ஃபெக்ட் சென்சேஷன். இது ஃபுல்லாக ஹீல் ஆன அப்புறம் நம்ம ஃபைன் திங்ஸ் 2வது வாட்டி பண்ணிக்கலாம். இன்னொரு வாட்டி அது என்னெல்லாம் பண்ணலான்னா, we can do the nose, we can do the lip. ஏன்னா நோஸ் வந்து ஸ்டார்டிங் இந்த இடத்துலலாம் டிப்ரெஷன் இருக்குது. மேலேருந்து ஐ couldn't come too much. எவ்வளவு நேசல் பேஸ் வரைக்கும் பண்ணிட்டேன், பட் அந்த க்ரூவ் வந்து இங்கே வரைக்கும் இருக்குது. இப்போ இதெல்லாம் வந்து நம்ம அங்கேருந்து பண்ண முடியாது, இங்கேருந்து பண்ணணும். ஸோ தட் வில் பி another approach. I don't think you will need it really. அது அன்றைக்கே ஓரளவு செட்டில் பண்ணிட்டேன். அது ரொம்ப மோசமாக தெரியாது. வேணால் அது நம்ம கொஞ்சம் டெர்மபிரேஷன் மாதிரி பண்ணி ஒரு நியூ லேயர் பண்ணிக்கலாம். அது சின்ன ப்ரொசீஜர். இது கொஞ்சம் மேஜர், இது மேஜர், இது மேஜர், இது மைனர். லிப்பு வந்து நம்ம உள்ளால் ஆறுனப்பறம் தான் வெளியில் பண்ண முடியும். ஸோ யூ ஹேவ் டு வெயிட் ஃபார் அட்லீஸ்ட் ஒரு 3-4 months. 3-4 months வெயிட் பண்ணுறது பெட்டர். எதுக்குமே இங்கே ஏதாவது ஒரு சின்ன இம்ப்ரூவ்மெண்ட் வேணும், அதாவது யூ ஃபீல் வி கேன் கன்சிடர். இப்போதைக்கு வி won't do anything. But overall, I told you it will be 90%, but it's maybe 95%. Huge improvement is there. All the inga vandu romba mosama irundhu, it was very hard. Adellame I fixed it from inside. We've done it. We've got a pretty good thing for you. Neenga immediately, most important thing is you have to make sure that everything heals well. First 7 days has been uneventful. So if you take care for another week, then you're totally out of any danger. So this was a very challenging facial asymmetry deformity correction, which we used techniques working on the bone, working on the soft tissue and the muscle, also using alloplastic materials at the same time. So cutting the bone, osteotomy, shaving the bone, osteoplasty, using peak type materials and fixing it with screws. All of this has been done in one go. Chin, lower jaw, other side of the mandible, angle osteoplasty, genioplasty, work on the masseter muscle, buccal pad fat, malar contouring, augmentation of the cheek on the left side, and then the forehead, which involved pexy on the frontalis muscle with a bicoronal approach, and also onlay over the frontal bone. So it took us over 7 hours, but we've done an entire reconstruction kind of. It's more of a reconstructive plastic surgery rather than a cosmetic plastic surgery. But yes, as you can see, there's no scar that's going to be visible, and the improvement is going to stay for life. It's still going to be some more time of healing, maybe a week more, but the first week has been really smooth. We're very excited, very happy for her, and we will follow her up for 3 more days. On day 10, those staples that you see on the scalp, we've used staples because it's faster, and anyway on that part of the scalp you're not going to see the scar. The hair is going to grow, and eventually she'll be able to comb her hair behind. Just have to be remove the staples so that no one would ever know that she had a surgery on the head for the forehead. That's the plan, yeah. So these are the issues with the forehead, with the cheek. You can see the width of the face was way too less here. Projection was less. There was a deep scar. She's had a couple of procedures in different hospitals across India. Here as well issues. There was a big issue here on the eye. Now you can see that severe grooving or notching, a big depression, notching, grooving, depression. So this is all part of a rare syndrome that we call as Parry-Romberg syndrome, which basically affect individuals in their second growth spurt, typically between 13 and 15 or 12 and 14 years. That's when some part of a hemiface doesn't grow to what the other half of the face grows. The problem involves the hard tissue and the soft tissue, and therefore when you correct it, we try to correct it on both. I haven't done any major fat augmentation for her. That's going to be a final work if we need to do, which we would consider 6 months later after we worked on the bony skeleton and on the muscles. Let us stay here till such a time there is a problem with the room. So இன்னைக்கு no problem. நாளைக்கு யாராவது வந்தாங்கன்னா நாளைக்கு சொல்றோம். நாளைக்கு if some more people are getting discharged. So maybe we'll have rooms. Let's see. Yeah, apply copious amount. Like let it cover it fully. Don't make it thin. Just apply and then apply ointment on top because both the openings should. मम्मी का भी लेना और सुनो ये हमारा
Did you eat in the morning?
I have juice and milk.
Paining?